Medical engagement in our organization is based all around patient-centeredness. We believe that it is everyone's business. Medical engagement is 24/7. There is no holidays. In NHS Tayside, we believe that every individual at the forefront of clinical practice should be involved 100% in giving the best, most effective, safe and patient-centered care. And the way we make it happen is by creating a network that supports all the microsystem, i.e. the clinical groups, to the small groups, which forms, for example, the surgical group, the specialist group, the acute medical group, and they can join in all together and networked in a way from the floor right to the top of the pyramid. They're all connected. We're trying to liberate the clinical microsystem. We want to see the microsystem leadership, where every individual is coming in, giving their best, in their best effort to make patients' care safe and of high quality. The most important challenge that we face engaging doctors is the culture. And culture is the key to make any form of improvement work. The problem we have here is the doctors at the coalface is working hard, working day in, day out, making a difference to the patients, to applying the value, what they really care for. But they're often distanced from where the decisions are made in terms of where the monetary importance is, where the money should be involved. And often we see the difference between the two worlds, what I call the east side and the west side, the managers and the clinicians. These two forces are trying together to improve patients' quality of life and safety. However, for some reason, they're not together aligned. What we really need to see is the goals of the managers and goals of the clinicians and goals of the senior managements are all aligned together. So we have the same value, with the same beliefs, we're aligned together, working for the patient and always keeping the patient at the center of our attention. The most important challenge that we face is the culture, changing the culture. A culture that doesn't have a memory. If we go back to the point when we talked about organization with a memory over a decade and a half ago, we still do not have an organization with a memory. We're not listening, we're not learning. We need to have our values together. We need to be focused on our values and work forward with keeping the patients at the center of our practice. That will create a culture of success.